Hi, everybody. Welcome to, I think this is our 5th session of the John Howard Society Virtual National Conference. Thanks to all of you who have been able to attend before, and any new people, hello and welcome. I'm Liz. I work for the John Howard Society in Vancouver, and I'm very pleased today to be joined by Korchinski and Pam Young from Unlocking the Gates. They're going to be speaking to you today about the value of peer mentorship as people transition from prison to the community. And I think, as many people on this call would be aware, this is an extremely vulnerable time, and it's made increasingly more dangerous given the other public health crisis that Canada faces, the opioid epidemic, which Mo and Pam are going to be speaking about. So as with our other sessions, we will be we'll be running this chat box over on the right-hand side of your screen. So if you have questions, feel free to post them in the right-hand side here, and our presenters are going to be monitoring and will be able to answer as many as they can. Aside from that, we'll kick off, and I'll hand over to Pam and Mo. Thanks.
Hello, everyone. So again, we're with Unlocking the Gate Service Society, and we're just going to do a little quick introduction. So my name is Korchinski. I'm the project manager. I've been involved in prison health for 14 years on this side of the gates, and about 6 years while I was incarcerated. I have 28 years experience with addiction and 8 years of going in and out of the prison system. And today I'm passionate about helping people reintegrate back into society. Main reason I got involved in this is because I was sick of people coming out of prison and dying. So that's what drives me to help people leaving prison. And just a quick background, I've got my degree I'm a registered social worker, and I live in Maple Ridge, BC, and our project is all over the province of BC. I'll hand it over to Pam.
Hi, my name is Pamela Young. I'm the project coordinator. I've been with the project about 8 years. I have over 20 some years of lived experience. I spent 19 and a half years on the downtown east side in Vancouver. In active addiction. I've been clean 11 years, and I've been out of prison 11 years. And I do this because I really care about people, and I know that I could have benefited myself from a program like this when I was going through in and out of corrections. And like Mo, it's hard, like seeing people come out and die, and it's motivated us even more than ever to keep doing the work we're doing.
Okay. So just get a little bit of the background. So when me and Pam were inside the Alouette Correctional Center for Women, what is a provincial prison in Maple Ridge, we had a fearless leader, Dr. Ruth Alward Martin, who really wanted to start realizing that there was more to women coming in and out of the prison system than just the crime. So she actually got a research grant to do participatory health research inside the prison, what became a job placement. And out of that, the women got to research their passion. So people were interested. They did health forums every month where the community came in. And out of that, they came up with 9 health goals, what you can see on the screen, what women said would stop them from reoffending. So we took those 9 health questions and moved to this side of the gate, and I sat at the bus loop for 3 years where women got dropped off and interviewed them about these 9 health goals. And out of that 9 health goals, I really noticed that women had no idea how to get back home, where they were going. They had no resources. They were lost. And that's where we came out with our project of, mentoring people coming out of prison. So we also have a paper which talks about the factors which support successful transition to the community. And I'm not doing that. Okay. And I'll pass this over to Pam, and Pam will explain a bit more of our program.
Okay, well, hey, I'm just well, I guess I'll read a little bit of this. UTG members provide incarcerated individuals culturally safe, trauma-informed, and accessible peer-based supports upon release from prison. It's crucially given their high prevalence of social, economic, health deterrents, including illness, overdose, social exclusion, and death. In addition, strengthening prison release planning and community-based health supports during the transition from prison to community is integral to individuals' rights to health, security, and culture. So, I mean, our mentors are, I mean, we make such a great connection because, I mean, we can relate to what people are going through. And we've been through all these determinants ourselves. So we can kind of connect on a deeper level because we've experienced it ourselves. Mo, did you want to add a little bit to that?
Yeah. So again, everybody who works for us, so we have 10 staff all over the province. We work with men and women, provincial and federal, and everybody who works for us all have to have prison experience. So we're really strict on, so we make sure that people are 2 years out of the system, 2 years clean and sober, you know, making sure that they're healthy to be able to work with somebody come out of prison, because you're guaranteed you're going to work with somebody who you've used drugs with or if you've done jail time with. So for me, when we first started this program, I didn't want to lose somebody who was doing well in the community because they get sucked back in with somebody who they've done jail time with or crime or addiction. So we do a lot of training. We did our own training manual with boundaries, and you know, boundaries is the biggest one. Remember, you're working with people who like to manipulate, and but you can't manipulate somebody who's been there. So that's one of our values too, is you know, we can see when somebody's struggling, and yeah. So go on the next one, Pam. Here, there you go.
Yeah, so it's okay, peer-to-peer mentoring. So as Mo was saying, everyone has the lived experience and they've all experienced incarceration. All of our mentors have lived experience with addiction. So the peer-to-peer is, I think, basically it's about connection and being relatable and being able to like share your story and share your experiences, share your successes and what did and didn't work for you personally. And by sharing your own, I find by sharing my own experiences, it really empowers other women, because then they can see like, hey, you know, this person has been through very similar things as me and they were able to accomplish these goals. So I think it's really empowering for people being released to connect with someone who their peer who is out here and has reconnected with the community successfully and you know is moving forward in life. It's really inspiring for them. And you know, like the biggest comment that I get that stands out to me is when I pick up women and they're like, how do I do what you're doing? And my goal is to be a peer mentor. And you know, it's empowering for women because you know they can start, you know, setting those goals and working towards, you know, becoming a working towards peer mentorship themselves one day.
Mm-hmm. You know, we have such this concept that, I mean, I had it too when I came out, is that once you've done jail time and you have a criminal record, you can't do anything, right? You can't get a career, you can't work. And, you know, and being able to say that we've all, you know, Pam's gone back to school, I've gone back to school, you know, that I'm a registered social worker and I have a criminal record, right? So you can move forward and your past doesn't define who you are. But a lot of people, it's not saying it's easy to get past that, the judgment. And I think a lot of judgment comes from us as well, thinking that everybody's judging us for our past. So that's something that we really work on with our clients. You know, we travel all over the world and present. So it's another thing too. People go, well, how do you get out of the country? I'm like, you can go everywhere but United States, right? So it's giving people hope that, you know, I was a permanent fixture inside the prison system, and now, you know, I'm doing great. I have my kids back in my life. I got a job. I drive a nice car, and that's what people want. You know, if I could if I got $1 for every time I heard somebody come in prison and say, okay, that's it, I'm done, I'm never using again, I wouldn't have to be working, right? It's not something, once you relieve somebody from the streets and the addiction and the drugs and you get them inside, I think we're really missing an opportunity where people could heal and change and deal with their issues. And that's where our program comes in. Our numbers are free calls, so women can call and talk to us. And it's that stress of coming out which starts getting people aspiring and going back to what they know, because it's comfortable. You know, change is hard. Change is uncomfortable. And that's where we come in, as having that connection, because I still remember 14 years later, the anxiety, the stomach flipping, everything, what it was like the day I got released. And it's so easy to go back to what you know. And I'll tell you, going back to the streets and going back to people you use with and going back is so easy. It's so non-judgmental. And it's so hard to bridge that gap between, you know, the crime, the addiction, and mainstream society. Yeah.
UTG peer mentors whose perspectives are enhanced by their lived experience with the justice system and addiction. Yeah, peer mentors, like they inspire hope, and it's kind of what I was just saying a few minutes ago. It's, you know, we show people, we kind of share with our own lived experiences, and you know what is working for us, and what changes we needed to make, and you know, like reminding people of how easy it is in the other direction. Like Mo said, like the street doesn't judge you, that community doesn't judge you. You're there. When people go back to that life, they're welcome with open arms, and that's where we kind of try to bridge that gap, where, you know, we're welcoming people with open arms, and we're offering, you know, to support people in their journey, instead of you know, like trying to make them see that, you know, maybe sometimes the community isn't always so welcoming to people coming from prison, but there is people out here that do care and will support them.
I'll do this one.
Okay.
Yeah. So as I said, you know, we just walk along beside individuals. So when we go through to, you know, achievements, again, I'll go back. We ask what they need, not what, we don't tell them what they need. So when between our relationships, and then we do an intake and we find out what they need and where we can support them. Sometimes it's not the most safest plan, and it's not something what, you know, we know is not going to be a successful plan, but it's not us to be there to judge, us to be there to support them. And hopefully when we do pick them up, that we be able to you know, have that conversation with them and give our experience and the hope, and that there is a way out as well. Okay, values. So this is something what my team and I feel very strong. Our voice and the knowledge that comes from our lived experience, empowerment and advocacy, self-determination. We believe to support self-directed, client-centered, and health goals. Everyone has a desire and everybody has that's the interesting thing. Everybody has a desire to change. They just don't know how and don't feel like they deserve it. And, you know, it goes back a lot to childhood trauma, you know, not believing in themselves, not having that self-confidence. You know, life is really beating them down. And for us, it's how do we, you know, bring them back up, and, you know, they deserve a better life. And mental health and addiction and crime does not define us. And we're definitely there to show them that change is possible. Yeah. Right. So peer mentor program supports people as they transition from correctional centers. I think the biggest thing is that people, what we take for granted is that, you know, people need food, clothing, shelter the day they get out, not a month down the road. And that's one of the big barriers, is finding resources for people when they get released from prison. A lot of places don't take people directly from prison. And again, you know, sending somebody to a homeless shelter where everybody's using is not much chance that somebody who just got released from prison is going to stay sober. So that's where, you know, one of a lot of our barriers is a safe place for people to get released. You know, and just connecting them to healthy resources and being a, you know, a positive role model. Okay. And again, it's that hope. I think hope is huge, right? And it's interesting because when you're inside, you have, you know, you have a job, you have, it's a community, you have friends, you have clothing, you have food, showers, everything. And all of a sudden your time's up and you get released and you have no hope, no purpose, you have nothing. Right. And it's quite the shock of being able to be, it's, you know, jail is its own little community. And then all of a sudden it's like, okay, well, your time's up. Time for you to leave and you have nothing. You know, what's the chances that somebody's going to change their life around if they have no food, clothing, and shelter the day they get released? So that's where our program comes in and making sure that no one falls through that crack who wants help. Here you go, Pam.
Okay, this is the online CSO, not CSO, the online court registry. Every day for years, I go on the court registry. You know, I didn't really care for this tool when we first found it because, I mean, it puts a lot of people's information out there publicly, but we use it to our advantage to, I look up daily to see who's on the court list, and I send a letter, invite letter about our program. And if I see someone shows up in custody, I send off the letter to the correctional centers and invite them to call us and get involved and maybe possibly participate in our program. It's really been a helpful tool, and we in the beginning we didn't have, like, we now we have posters on the units, and but we really relied a lot on the court registry in the early years of our program. Yeah, it's been very beneficial and it's been very helpful. I'm just curious if I'm still connected. I don't see Mo here now.
We're still connected, Pam. I think I might have
Okay,
lost her
great.
connection.
Thank you. Okay.
You could carry on.
Yeah, so the court registry has been very helpful in connecting us with people who are inside. And, you know, basically we can just go on here. It'll show us who's in custody, who's not in custody. And if I see someone is currently in custody, I will mail a letter to the correctional center. And this is our actual invitation letter that we send out, and it just, you know, gives our numbers and tells them a little bit about our program, you know, letting them know that we've been there ourselves and we've been through the revolving door, and we know how, you know, overwhelming that can be, and that we're here to support them. And then they are welcome to call and do an intake with a telephone intake with us, and we can connect them with a peer who will meet them the day they're released. And this is the actual poster that they post on all the living units in BC correctional centers. These are all over the province, and we currently have mentors in various different parts of the province. We're in the process of expanding to other areas. But even if we're not specifically in a specific community, we will support people by telephone. So once they have, you know, see this, they contact us through the post, they can call through the number on the poster, and we will connect them with services, you know, that are available if they have them available in that community, if not by phone.
Okay, I'm back. Sorry, I lost internet. So again, we get a lot of asked, how does COVID-19 affected
Uh-oh. The opiate crisis and COVID-19 has really affected. Well, I mean, our program is still running, and we made that decision. Oh, I'll let you take over, Mo.
I don't know.
You're back, are you? Okay. I was just saying, I just started to talk about the opioid crisis and
Can you hear me now?
COVID-19. Go ahead.
Okay.
You look like you're ready. Yeah.
So I mean, COVID-19 made our team decided in middle of March that we were going to continue working, that we were not going to stop helping inmates coming out, especially when they were doing mass releasing. What people had, again, nowhere to go. They shut down most of the transportation. Most of the houses shut down, shelters shut down, and all of a sudden now we have, hundreds of people trying to get released with no plans. So to change to our procedure, I mean, it changed for a bit. We asked people to wear masks, so we get offered masks when they come in. Our staff wear masks, and it really changed our relationship with corrections. Because for us to be able to keep doing what we're doing, we had to make sure that our staff were going to be staying safe. So we made sure that people were, COVID, they had COVID tested, they had healthcare check, that they were in for 14 days, making sure that they weren't stopping anywhere. And if they did, we had to teach them about social distancing. And can you imagine, I mean, we all learned COVID as the days went on. Can you imagine him sitting in jail for 6 months as COVID's going on and all of a sudden get released? The world has changed, right? It's totally different. People are lining up outside. I remember taking people to the ferry and it was like a ghost town, right? And it's already overwhelming getting released. And the biggest difference I see people inside prison right now is it's not so much about the drugs and everything, it's the fear of COVID. Like, where am I going to go? What am I going to do? I have no housing. I can't get anywhere. There's no clothing because, again, everything's shut down. And we left, and then we decided to mass release everybody into the community without any support. I'll turn it back over to Pam.
Yeah, it's been a real shock to people when they, like Mo was saying, when we pick them up, they can't believe like the special lines on the floor and, all the guidelines and rules and procedures they have to follow. And, it's just a real eye opener, and people are wanting to like reconnect with family, and people are talking about, worrying about their kids. Maybe when they go into custody in the past, they are concerned about addiction and using when they get released. But suddenly there's a shift and people are wondering about their children and their families and, worrying that they're safe. And but I mean, it's been a challenge, like, especially with the lack of housing. I mean, in some communities in BC, like, for instance, Kelowna, it was a real struggle to like find accommodations for people leaving the correctional system. And I mean, it's been like that all over, but like where there has been like only very, very random cases in provincial corrections, I don't know if maybe the community isn't as welcoming when they know they had a case in a prison near them or something, but it just seemed like a lot of doors were closing really quick because of COVID and lack of services available, nowhere to take people to pick up, a couple changes of clothing the day they get released. Like a lot of those services that closed, slowly they're opening back up again. But I think the most difficult part of all this is the opiate crisis and COVID-19 and the procedures that were put in place early into COVID-19 around resuscitation and guidelines around resuscitation. If someone is overdosed, we're not allowed to give people breaths at some points they told people not to give breaths. So people were waiting, 10, 12, 14 minutes for an ambulance to arrive. That's really scary. I mean, I have friends who are working in overdose response, and it's a very hard thing to do, to stand by and not give people breaths. And that's the biggest thing that stood out to me during COVID, is like watching my friends who work in that community struggle with the fact that they're responding to overdoses and they're being told not to give breaths. I mean, that's a very difficult position to be in. I couldn't imagine being in that position. Like, fortunately, I haven't been responded to any overdoses. And then there's the tainted drug supply right now. I mean, the borders are closed. No one is, the drugs aren't coming through as steadily as before. People are creating their own concoctions of, different pharmaceuticals that they mix up, and, often fentanyl is added to, provide more strength to whatever they're making, I guess. I don't know how you would say that technically, but it's just really making for a dangerous and bad situation, and with all the extra serve money that's been people have applied to, it's increasing people's the access to money and having more money and more drugs, and it's just increasing the potential for overdose.
Yeah. And supporting housing. I mean, it's always been one of our biggest struggles and challenges, even before COVID-19, is finding supportive housing and safe housing for people. Somebody asked the question, do we have houses? No, we don't. That's another whole different ballgame. So we do work with a lot of places, and we've had great relationships with treatment centers and recovery houses. So far, we haven't had anybody fall through the crack. So we've managed to, Pam's amazing at what she does, and been able to find housing or somewhere safe for somebody to go who's coming out of prison. But again, COVID-19 is not going anywhere, and, we need to change with the times. I always say you got to co-live with COVID. And somebody else is stay home. Yeah, we support it. We support our clients, whatever they need. If they need to go NA, AA, clothing, doctors, methadone, we do it all. Whatever the client needs, we support them. And again, like I said, there's such a gap between people. It's such a gap between people who are getting released from prison and how to bridge that gap back in society. And someone want to know, we're actually funded by First Nations Health Authority, but we're not restricted to just dealing with First Nations. Our program serves all nationalities. Our program, so it's supposed to be a 72-hour program, but I've been working with clients for 3-4 years. We don't end that relationship. As long as the client wants to have a relationship, we have a relationship and we support them. And the really cool thing is, Pam showed you the letter, what we send inside to prisons. People take that letter as a safety net, and we'll get a call 2 months down the road after they're being released, and they're like, hey, now I'm in trouble. I need help. I brought your letter with you. Can you help me? So we don't stop anybody, and we don't turn anybody away from our services. Right? Yes, we're a program that helps people coming out of prison, but we support anybody who reaches out to us. And anything else, Pam?
No, I mean, I guess I could say the same thing as you, that, our relationships maintained for years sometimes, and, people will come and go different points of their lives, but they'll, check in when they need support. And, if they're struggling with anything that, it's been interesting too, now that we're, working with federal, men and women, as well. It's like the total difference in needs. I mean, it's a lot different for formerly federally incarcerated men and women than it is for the provincial. I mean, there's a lot different resources they're wanting to access. It's almost like night and day as far as mentorship goes.
Oh, so we also know how many people we work with. It really depends. That's the interesting part about this job. Sometimes you can have 5-10 people in a week. Sometimes you can go a week without having anybody. It really all depends when somebody's getting released. As they mass released everybody, I think in the provincial prison here in Maple Ridge, is 2 years less a day, I think there's only like 41 women right now inside the prison. So the prison count's really low. But again, we're still working, and they're still releasing people. people who shouldn't be getting out are getting early bail and early release. So, go for it.
And oh, sorry, I was gonna say, early on. Oh, sorry, and early on, the numbers were higher. Like early on in COVID, the first 2 to 3 months, it was really busy. You know, there was a lot of releases like in a short period of time, and then now it gradually, the last month or so, it slowed down a little bit again. So I'm not sure when the courts are going to start getting busy again. I anticipate that's going to happen soon because a lot of people have been charged with different things during COVID, and they've been releasing a lot of people and just giving them court dates down the road when the courts are more actively open again. I mean, they are open via video, but they're not actually open in person, I don't believe yet. So when that happens, I anticipate it'll start to get busy again.
I just gotta say hats off to BC Corrections for the job they've done in the last since COVID hit. They're, you know, they've done an amazing job of making sure the inmates are, you know, safe. Like we know there's only been 2 cases in the provincial prison, and it never went farther than 1 case. So having people so close quarters is, yeah, a big hats off to them. And I can't say more than enough of our relationship and what they've done for inmates inside. So.
Yeah, they've definitely gone the extra mile, like driving people to their destinations, driving people to like Kelowna and from the Lower Mainland. Like there's been really a lot of them. I mean, it's kind of sometimes I look at it like it seems a little strange that I'm like supporting corrections being formerly incarcerated. It feels a little weird sometimes, but they have done an amazing job, and they really are going over and beyond, and like actual correction staff, like advocating, helping find people beds. And like then from the past to now, I'm finding more people coming out that already have a bed set up for them by corrections than before, when we would be the ones looking for the beds. I mean, they're just really gone the extra mile. It's really good to see, and hope that maintains after COVID.
And I think
too.
also just the teamwork on the release planning. I always say, you know, you have that saying, it takes a village to raise a child. I think it takes a village to support somebody coming out of prison, and we're really good at what we do out here in the emotional support and the hope, but being able to have that better relationship and being a bigger part of almost all inmates release planning would be something I like to see continue and be a little bit more involved. And so, yeah. Right. And I guess for me, my biggest concern is, I know we mass release, you know, we're going to see a mass incarceration, right? You know, public is not going to sit there and realize that, you know, just keep charging people and releasing them. And, you know, we know the crime's going up in areas. And my biggest fear is that we're going to start mass incarcerating people and putting everybody in risk who's in there. And the pressure is going to put on BC Corrections, because people got to be self-isolated for 14 days when they come back in. And, you know, there's a lot of chances of cross-contamination. And that's one of the big fears about people, you know, people that are serving time right now. You know, they know they're safe right now, and the biggest fear is when somebody comes back into the prison system or do they have COVID? Right. And then, like I said before, it's really interesting that people inside prison aren't so worried about, you know, the drugs and the crime. It's about their safety and COVID-19 and, you know, how they're going to get home and how do they get to see their family and their kids, and family members are reaching out to people inside prison. So there's a huge shift on people's values and perspective of what they want to do when they get released. What I think is super interesting, maybe, you know, I was gonna say, you got to find the good somewhere along through COVID-19, and I really like to see really enjoy the shift in people's attitudes and corrections and what's going on. So, yeah. Anything you want else to add, Pam, to the opiate crisis?
No, I think we covered it.
Okay. Again, so one of the things what we love doing as somebody who works for, so we work out of the UBC. For now, we just actually became a nonprofit. So super excited about moving our agency in and growing it. So one thing we really want to work at is preventative youth outreach, as well as what we do with the prison mentor program. So super excited about where we get to take our program. But we're also, for me, when I started doing this, and I work with a lot of academics and a lot of, doctors and everything, we read a lot of research papers, and I'm like, but no one reads them unless you're in school, right? So for me, the only way we're going to change people's perspective about people who are on the streets in Vancouver, in Surrey, or downtown East Side, or people coming out of jail, is people really get to know who people are and to humanize them. Because I tell you, that was me and Pam, going in and out, in and out, in and out. So there is hope. And, I'll tell you, the hardest thing I've ever done in my life is be a drug addict, right? It's never ending, trying to find the money, the dope, the crime. You go into jail, you lose everything, you come back out, you build up this empire again, you get arrested, you lose it all, and it's this constant revolving door. Okay. So anyways, this is a little poem. So we actually have, so I actually became a filmmaker and a documentary. So I make documentaries for people. And then we actually have 2 books wrote. So this is a found poem, what a colleague of mine who passed away last year, Carl Lego, who wrote and says, listening to the women, we are not stereotypes. It is possible to turn your life around. It is possible. We like having jobs, going shopping. We have nowhere to go and no means to go anywhere. We should not be judged. Jail sucks, shitty place. We are scared, life is hard. We need somewhere safe to go. We need resources. We need support. We need skills. We need love. We deserve the same chances of others. We aren't bad people. Just because we made a few mistakes doesn't make us bad people. We aren't bad people. Just because we did a little time, we made some bad choices. We are not monsters. We're people. We're women. We're human. We can recover. We can change. Life after jail, new meaning. We aren't alone. Shit happens. There is hope. So these are all questions from some of our intakes. What we do, we ask people, what do you want people to know about people leaving prison? And these are some of the answers, what are pretty powerful, and a lot of them I find very sad. And again, I said we've done 2 books. So we have a book called Arresting Hope and Releasing Hope. And we're actually now getting in the process of doing a 3rd book, and we want the voices of the children of incarcerated parents. So the first book, Arresting Hope, is stories about people going in and out of the prison system, what it was like inside the prison system. And Releasing Hope is stories about people once they get released. And I'm really passionate about the hope, because without hope, we don't have anything. So that's where I'm at. And there you go. Does anybody have questions? Because that's the end of our presentation. And thanks for listening, the 51 people that are on. Sorry, this is really different, just looking at my colleague and nobody else. Yeah. Yeah, workshop.
Would you be interested in doing a workshop for staff working in the new bail release program that's being run by John
We're
Howard
always
Society?
available to come and speak. I said that's one of the biggest things. What I say is we got to change people's perspective of who people are in prison and what people need outside prison. And it's interesting. I always get asked, to join other places because we have the expert with the experience. And I've been being asked for 14 years, and I'm at the point like, we need change. We need change now. So I'm very interested to talk with the new bail release program to Andrew. Yeah, just contact me. There's our contact information, so you can just take that and reach out to us. Oh, somebody said sign them up, Liz.
They may have already been on my to-do list. And and Mo and Pam also, thank you for always being available. I know you support our peer mentors that do similar work in the provincial correctional centers already. So thank you so much. Thanks so much for sharing those insights and observations about your lives and how you support women and men now coming out of prison, and as well all of the insights and the pieces that are happening because of COVID. I think we're aware of it, but hearing it and it being reminded is so important. I was plugging away some of the questions, like what do we hope to see, the changes, the innovations that have happened, what are those that we can continue, that we can sustain into the future? Because some of the changes that have happened have been very positive. So the fact that your relationship with BC Corrections has improved is just awesome. So that's some silver linings to a pretty dark cloud. But thank you. Has anyone else got any other questions that they want to ask Mo or Pam right now? I've had a couple of them come through. And I was saying earlier to Mo and Pam, like, you don't have to answer the questions as they come because it can be quite distracting as you're trying to present, but they did. They're extremely efficient. And I will back them up to say, yes, it's kind of awkward speaking to yourself and not being able to see who you're talking to. But thanks to those of you that did ask a question. And I hope you felt like it was answered. And I should echo as well what Pat said up here, that the work that you guys do at Unlocking the Gates is so impressive, and serious hats off to you and everyone you work with. So thank you.
Thanks.
Thank you.
Okay, well, Mo and Pam have their email addresses up here if you guys want to be in touch. And just to let you know as well, next week we have Claire Gallant from John Howard Society in Edmonton. She is going to be speaking to us about the design and implementation of the Domestic Violence Justice Response Project, along with the early findings and the anticipated outcomes. So I hope you can all join us again next Tuesday. And thanks again to Pam and Mo.
Thank you.
Have a great day, everybody.
Thank
See you
you.
later. Bye.
Bye.